I'm always excited to talk about the career that I have had for the last 32 years. It's provided great opportunities for me and also helped to support my family. I'm married. My husband and I have four boys. They're all legal adults now, but it has helped us support our family throughout the years and been a great career for me. So I'm always excited to talk about it. Um, as Lori said, I started at a community college in Iowa. I grew up in Iowa. I went to the community college for 1 year. I doubled up my credits, so I graduated with my associate's degree in a year. I then transferred to Brigham Young University, obtained my bachelor's in health sciences with a provider in, or with an emphasis in provider health. And then I went on and went back to the University of Iowa, where I did their radiology program. I worked as a tech for many, many years. And then just about 5 years ago, went back to school and got my master's degree because I knew I wanted to eventually teach. And ended up moving to California from Salt Lake City about 5 years ago and got a job teaching at Foothill, which is a phenomenal program. And I will share a little bit about that program in my presentation. So let's get started with the slideshow here. So we call radiology, or it's also called imaging, as you may hear it called, the eyes of medicine, because truly we see inside the body. And without us, physicians and providers would not be able to make accurate diagnosis. So what we do is very important. It's more than just pushing a button. We are dosing a safe amount of radiation to a patient, which is very important. Radiation or X-rays, you can't see or taste or hear or smell, which makes it even more dangerous because kind of like see no evil, hear no evil, do no evil. But radiation is very dangerous, but it can be dosed in safe levels where the benefit outweighs the risk. And so it's our job to do that, which is why it takes a full 2 years to be able to do this job. And it's not just an on-the-job training. Right. Oh, so what is radiologic technology? So radiologic technologists are the medical professionals who perform diagnostic imaging examinations, such as an X-ray. I'm sure many of you have had an X-ray before. So an X-ray or a CT scan, sometimes the public calls them CAT scans, an MRI scan, all of those are done by a radiologic technologist. And once you earn your radiologic technology credentials, you sit for the board exams and get that, then you can go on and specialize. And you can specialize in CT or computed tomography. You can specialize in MRI, magnetic resonance imaging, mammography, which is breast imaging to detect breast cancer, cardiovascular or interventional radiology. That's more done in a surgical setting. And then also radiation therapy. So there's a lot of different areas that you can specialize in, and it makes it for a very wide range of opportunities that you can go do in this career. So first is diagnostic imaging, and that's just a basic X-ray. So I'm sure many of you, like I said, have had X-rays before. This is an example of a KUB or an abdominal X-ray. And you can see that this patient had a pathology that we call pica, where they like to eat things that are not meant to be edible. So usually this is a psychiatric disorder, but we often X-ray people or even children who swallow things. And I'm sure, as you can see, we have some batteries that we're seeing in the bowel here, and a key and a key ring. They have a very full bladder that we see down here, but this is diagnostic imaging. What you think of as X-ray is diagnostic imaging. Then we have fluoroscopy. Fluoroscopy also uses radiation or X-rays, but the difference is instead of just one quick picture, it's a video. So compare it on your iPhone as taking a picture of somebody versus taking a video of somebody. So when we do fluoroscopy, we are watching inside a patient's body in lifetime. So it's like a live action film inside someone's body. And this image here on the right is of the stomach. The stomach goes across the body here, and the white that you see is barium. It's a contrast that we've had them drink, and it's in their stomach now. But we watch them drink it, we watch it go down their esophagus and into their stomach. And so that's how we see it, is because the contrast is more dense. And so it absorbs those x-rays and shows up as white. Anything on an x-ray that is black is air filled. So lungs, for example, look black. And then there's a lot of variations in gray. On the left here, this is the machine that the gentleman is touching, the technologist is touching, is just your basic diagnostic x-ray machine. But the machine sitting behind it is the fluoro part of it. So a fluoro room usually has both diagnostic x-ray tube and the fluoro machine. So that's what fluoro is. And in a radiology program or a radiologic technology program, you learn how to assist in the fluoroscopy exams. And then you in California, you have to have a special license for it. So you earn that as well. We're also in the emergency room in the hospital a lot. We do portable x-rays in the emergency room as well as patient rooms in the hospital. This image here on the left, you see the technologist, the machine he has is a portable x-ray machine. So we can wheel this into a patient room or into the emergency room like you see on the right-hand side of your screen, and do various x-rays right on the spot and get them done quickly, where we don't have to move a patient who's in critical condition. They don't have to leave the room in the care of the nurses and doctors. This is another example of an emergency room. All these medical professionals around this trauma patient, we are part of that trauma team. We are one of the first people that help to treat a trauma patient by doing various imaging of their abdomen and their C-spine or their neck and their pelvis. It's one of the first things we do with a trauma patient. So we are part of this team in here. Other areas you can specialize in include CT and MRI. A lot of people don't know the difference between the two. So CT uses X-rays. It's the machine you see on the image on the left. Think of it as a donut where the bed moves through the center of the donut there, okay? And this is in a pediatric hospital, so the room's been painted and made cute, so it's not so intimidating to our pediatric patients. And then on the right here, you're looking at the control panel of an MRI machine. And an MRI machine is more a tube instead of a donut. And the other difference is MRI uses radio waves and magnets to create an image, where a CT uses X-rays. They're used for various things. Um, they both still see inside the body. They both see bones and soft tissues, but some things are better visualized using MRI and other things are better visualized using CT. And then we move on to interventional or the cardiac cath lab. Like I said before, this is done more in a surgical setting. It's kind of a surgery suite. Everything is done under aseptic technique or a sterile technique. You can see everyone in the room has on the surgical gown and the surgical cap. The patient has been draped, and this machine you see over the patient, kind of like in a C-shaped, it's called a C-arm, and that is our X-ray machine. The technologist standing at the foot of the bed here is controlling that. And what the physician who is at the patient's side is advancing a catheter into an artery or a vein, and then we inject that catheter, the physician does, with a contrast that lets us see the mapping of the veins. So this helps us to find clots or to help us find a rupture in a vessel. We can feed this catheter up through the neck or the groin, feed it all the way to their heart and do imaging of the vessels to the heart. We can feed it up to the brain and do imaging of the vessels in the brain. So this is, again, an advanced modality that you can specialize in. This is another example of the C-arm here on the left. You can see why it's called a C-arm. It's in the shape of a C. Again, we use that in surgery as well as in the cath lab or interventional radiology. And then the image on the right, you can see on the screens there that that's the image that the physician is looking at. Looks like they are putting in a hip replacement on this patient. So this is you're looking at it from behind the surgeon there, and that is our equipment, the C-arm equipment over the patient. Some additional specialties that you can specialize in radiology are nuclear medicine. Nuclear medicine is really interesting because instead of the equipment producing radiation, it's the patient that is producing the radiation. So they are either injected or drink a substance that is radioactive. It literally has radioactive isotopes in it, which then they have markers on them that attract them to certain kinds of cells or cancer cells or certain organs. And then we just put the patient in a piece of equipment that allows the equipment to kind of read the radiation that's coming off of the patient. So it kind of flips how we do that. Instead of the equipment making the radiation, the equipment is just really sensing it and reading it, and the patient is the radioactive one. Then on the right, we have sonography, which you probably know as ultrasound. Everyone knows this as how we look at babies in utero, but ultrasound is used for a lot more than just those prenatal scans. We look at all kinds of organs and vessels and detect blood clots in vessels. And it uses sound waves. So there's no radiation used in ultrasound or sonography, but most sonography techs were X-ray techs first, and then they go on to specialize. It's not required that you be an X-ray tech first, but there is a requirement of a couple of years of patient care, of direct patient care. And most people do that by becoming an X-ray tech first and then moving on to ultrasound or sonography. Another area you can specialize in is radiation therapy. That's down here on the bottom left. There's a huge shortage of radiation therapy techs right now. And this is when we use high doses of radiation to try to help shrink cancerous tumors. It's very well mapped and marked, and it's very focused on that area. So that is radiation therapy, and that's what you're seeing going on there in that image. So let's talk about the education you need and the certifications or licensure you get. To be a radiologic technologist, you need a 2-year associate degree at minimum. Um, Local area colleges that offer this include Foothill, which is where I teach, Cabrillo College, Kenyatta College, City College of San Francisco has one, and I believe UCSF is even coming up with their own program. Merritt College has a program, as well as Santa Rosa Junior College. And then you can go on and get a bachelor's degree after you get your associate's degree. And the only place that offers that in the area here is Cal State Northridge, but there are a lot of programs you can do remotely. And then when you're done with the program, you sit for your national boards that gives you your ARRT licensure. That's the national licensure to be a radiologic technologist after you pass your boards. And then once you pass that, you mail that paperwork in to get your California license. So as long as you've passed your national boards, you just pay the fee and you get your California license. And currently, if you go through an accredited program in the state of California, then you also just pay the fee and get your fluoroscopy permit because you learn how to do fluoroscopy in an X-ray program. If you're moving to California from out of state, you have to take a separate exam to get your California fluoroscopy permit. So, for example, my students who are graduating now, when they sit for their boards and they pass their boards, then they mail in their payment and proof of passing their boards to the California License Division. They get their CRT to perform x-rays in California. They also will get their fluoroscopy permit. It's two different fees. It's $100 and some a piece. But because I moved here from out of state, I could get my CRT to take x-rays, but for fluoro, if you're moving in from out of state, I had to sit for a state board exam for specific to fluoroscopy. So I sat for that and passed that, then paid the fee and got my California fluoroscopy permit. Another thing you can obtain after going through a program is your California mammography license. Now, I can't speak for every program, but I know Foothills program because that's where I teach, and we do have a mammography class. We offer rotations in mammography for our students. And so, with a little bit more education afterwards, which we have a fellowship we offer after they graduate that lasts about 6 weeks, where they're performing mammograms and having a little more classroom work, then those students can obtain their California mammography license. And then you can go on and sit for your ARRT mammography license as well. And that's what I've done. I have my ARRT license in mammography, which is our national board exam again. Um, I think that covers all our certifications and licensures. And then let's talk a little bit about the Foothill Radiologic Technology Program. Now, there are many programs, like I said, in the area, and I can't speak specific to them. Everyone does things a little bit different. All the programs that I listed in that prior slide are JCERT accredited, which is our accrediting body for X-ray. If you go into a radiologic technology program, you want to make sure that they are JCERT accredited so you can sit for your boards. Um, our program here at Foothill, it's a 24-month program. It starts in July, goes all the way through 2 years and ends at the end of June. So 23 and a half months logistically, but we'll just round that up to 24. We are accredited by JCERT and also the Radiologic Health Branch of the state of California. Like I said, we begin in July and end 2 years later in June, and you go straight through the program. You don't really get the summer off, and that's really the case with most cohort programs. So where college is, you're taking a variety of classes and you have somebody different in your class and different people in different classes. When you're in a cohort program, such as radiologic technology or nursing or respiratory therapy, even, you have a cohort. So it's a group of students. They start the program with you and they continue on through the program for 2 years, and you're with that same group of people, and then you all graduate together. Um, our instruction during those 2 years includes classroom, of course. We have a laboratory that you will use a lot your first year. You're in there 3 hours a week your first year. And then, of course, our clinical hours where you are at a clinic or a hospital and you are helping to perform x-rays. And we start that right away in the summer. Our program starts in June, or I'm sorry, it begins in July. And by August, our students are in a clinical setting, helping to perform x-rays and having direct patient care. This is what our schedule looks like your first year of instruction at the Foothill program. You are in the classroom Monday, Wednesday, and Friday mornings from 8 until 11. You have one class each day your first year. So on Mondays, you have positioning and anatomy. On Wednesdays, you have physics. It's not physics like you took in high school or even probably college. This is specific radiology, specific physics. And then on Fridays, there's that Monday and Wednesday, those classes last all year, your first year. And on Fridays, that class changes every quarter. So like fall quarter, they have patient care. And then it moves on to different things such as a fluoro class. And then 3 hours a week, so one day a week after your morning class, either on Monday, Wednesday, or Friday, you will be in a positioning lab. Our laboratory in the college, and down here on the bottom right, you'll see part of the laboratory there. We have four X-ray machines and four X-ray tables that have everything on them. It's like a normal X-ray machine. The only difference is they cannot produce an X-ray. So we can't X-ray somebody with these, but we can literally do everything else. We can even set the control panel so we can tell the control panel what technique we would use. The only thing it doesn't do is produce those X-rays. So we break your cohort up into small groups, and you are in the laboratory with 7 other people. So it's a group of 8 for 3 hours a week. And this is where you practice your positioning and your patient care is in the laboratory. And then your first year, you are in your clinical setting or your clinical rotation, just Tuesdays and Thursdays, but it's a full day, usually from 8 to 4:30. That changes a little bit. Some places start at 7:30 and end at 4. It just depends on where you're assigned to. Again, this is a picture of one of these are our first year students in our positioning lab. You can see 2 other pieces of X-ray machines there, and they are practicing on each other. So they team up. There's 4 tables, so there's 2 students per table or machine. Somebody's playing the role of the patient and somebody's playing the role of the technologist, and this is how they practice their positioning and learn. As well as our lab where our students are practicing, off of that, we have an energized room or an energized lab. Now, this X-ray machine will produce X-rays. So students can come in here during lab hours and practice on these phantoms that you see sitting on the table there. Most of these are real human bones set in a polymer that mimics soft tissue. So the X-ray looks like you've taken an X-ray of a regular person. But this allows students to see what happens when they change the positioning of the patient or they change the technique on the control panel. It allows them to see what happens to the image without irradiating a patient, so it's safe. And as you can see, there's just some of our different phantoms we have. We have an abdomen and pelvis, which is the X-ray you see here on the right, and we have an arm and shoulder and a foot and a hand and various ones that you can practice with. Your second year in the Foothill program is a little bit different, where your first year is classroom heavy. Your second year is really clinic heavy. So you go from going to clinic 2 days a week your first year to your second year, you're in clinic 4 days a week. That's Monday, Tuesday, Thursday, and Friday. It's still those 8 hours a day, so 32 hours a week in clinic your second year. And then on Wednesdays, you're on campus and you're doing your didactic or classroom work. And that is a full day on Wednesday. You start at 8 and go till 4 usually. That changes a little bit each quarter, but is a full day of classroom activity on Wednesdays. And you don't do lab your second year. Your first year is when you do your lab. During our program, we have 4 clinical rotations in those 2 years that you're part of the program. The first one is 5 months that starts in July and it ends at Christmas break time. When you come back from Christmas break in January, you start your second clinical rotation, and that goes till the end of, let's see, about graduation time. So the end of June. It's 6 months long. And then you start a new one in the summer. And again, it's 6 months long again. So it goes to the end of the year again. And then beginning of the year is your last rotation, your fourth clinical rotation. And again, it's 6 months until you graduate. We try to send every student to at least one clinic, because clinic setting versus a hospital setting is very different. And even a level 1 trauma center, working at a hospital is very different than working in a community hospital. So we try to send you a variety of places so you can see what works for you and what you like the best. They also all develop different clinical skills. There's certain places that are good for repetition, so you can build those positioning and patient interaction skills. And there's other clinical sites that help develop critical thinking skills or thinking on your feet, thinking outside the box, and working those traumas. So not only do we try to give you a variety of scenarios, but we also try to put you in something that is going to benefit your skill set that you need in your skill set. These are all of our different clinical affiliates that we send our students to. We send them to El Camino Hospital, both in Mountain View and Los Gatos. We have a clinical affiliate in Hollister, which is Hazel Hawkins Hospital. And we have Palo Alto Medical Foundation, which you may know as Sutter Health. We send students to a lot of their clinics. They're very busy, up-to-date, modern clinics. It's a great experience for students. And they go to Fremont, Dublin, Palo Alto, Samaritan, which is over by Good Sam Hospital, Mountain View. Oh, this is a little typo error here. Sunnyvale and San Carlos. And then Los Gatos as well. So we have students at all those different Sutter clinics or Palo Alto Medical Foundation clinics. We have students at Regional Medical Center in East San Jose. We have many students at Stanford up at the main campus, and then they also rotate to what they call SMOC, which is the Stanford Medicine Outpatient Clinics, and that's in Redwood City. We have students at UCSF in San Francisco, and I believe UCSF, like I said, is starting their own program. I think our students will stay though. We also have students at Valley Medical Center, which is county owned, and that's in San Jose, very, very busy hospital and trauma center. We have students at Kaiser Hospital in Santa Clara, not the San Jose site, but the Santa Clara location. And then lastly, another recently county acquired hospital is St. Louise and Gilroy. It's more of a community type hospital, but again, still very busy and gives you different skill sets to develop. So what does the pathway look like to try to apply to the program at Foothill? There are 14 courses needed. They all are not prerequisites. These classes on the left in the blue boxes are prerequisites to apply to the program. But on top of those prerequisites to graduate, you also need these other things on the right in the different areas. And we want students to have all of that done before they apply to the program because it's really difficult to take additional classes on top of the program classes. But just to apply to Foothill, you have to have the anatomy and physiology series in biology, and that's biology 40A, B, and C. You have to have what we call RT 200L, which is an introduction to radiologic technology. It helps students decide if this is really something they want to do. And then any transferable math class. And right now, any math class offered at Foothill is transferable to UC or Cal State. So any transferable math class you have to have, doesn't matter which one. You need to have English 1A. You need to take Chem 25, and I realize they're redoing all the numbers, so it may be called something different now, but it's basically any chemistry class that has a lab component to it. So it doesn't matter if it's basic chemistry, if it's organic chemistry, as long as it's a chemistry class with a lab. This other one, the communications two, this is the one that we get a lot of confusion on, if you will. It has to be an interpersonal communications class. Interpersonal communication is used every day, all day in patient care. So it's not just a speech class, it's the COM2 class, which is interpersonal communication. So if you've taken it somewhere else other than Foothill, it has to have that interpersonal aspect to it if you're transferring it over. And then our last prerequisite is AHS 52, which is medical terminology, or any medical terminology you've taken at another college will do. Now, those are the seven, or I guess nine, because the biology is three classes required just to apply to the program. Um, After you apply, you can take these other classes as well on the right. The one course in area one course in area four, one course in area six, and two in area seven. So those are going to be different elective classes that you choose to take. So together, there's 14 classes needed before you start the program. Not to apply, but before you start. Some other program requirements that for admission include a physical exam. So once we select our cohort, we have a meeting, they have to get a physical exam done. This includes a TB test that must be negative. It includes a variety of vaccinations. This is not negotiable. All our students are required to have these vaccinations because you are having direct patient care, and our clinical sites require the students to have them. It's not the school that requires it, it's our clinical sites that require it for our students to be there. So those include MMR, measles, mumps, and rubella, varicella, which is chickenpox, the hepatitis B, and COVID vaccination. Now, I don't believe you have to have a COVID booster every year, but you have to have the base set of the COVID vaccination and be fully vaccinated with, I believe, one booster. Other than that, you also have to have a vision and hearing test done as part of your physical. You do have to pass a drug test. This is issued at the beginning of the program, along when you get your physical done, but also it is issued at various times in the program. Oftentimes, when you're changing clinical sites and going to a new clinical site, they request or require that. I do want to say that I understand that marijuana is a legal substance to use in the state of California. However, the drug test and our clinical sites require that that is a negative test. So you cannot test positive for marijuana and pass the drug test to go to clinical setting. So if you fail the drug test, unfortunately, you are dismissed from the program. You have to have your own individual health insurance, and that can include Medicaid if you are part of that group. And then you need to have a background screening done. We have a company that you do it through. At a minimum, this includes a social security number verification. This does not mean you have to have a social security number to apply for the program or to go through the program, but if you have a social security number, we need to verify, or the background screening place needs to verify that it is indeed yours and belongs to you. It includes a criminal search back 7 years. It includes employment verification for your last two employers. It checks the sexual offender and predator registry search, not only in the state of California, but nationally. It checks for Medicare or Medicaid and prescription fraud. It also covers 7 years of history, including two names and three counties that you've lived in. For our prerequisite courses, I should have mentioned this before, but all the prerequisite courses need to be completed with a grade of C or higher to apply to the program. The exception to this is your anatomy and physiology classes have to have a minimum GPA of 2.5. So what happens if you take the biology 40 A, B, and C and your GPA for those three courses is below 2.5? What you can do is register for an additional anatomy and physiology class, take another one to get a good grade and boost your average GPA for the anatomy and physiology. Our applications are submitted online. It's fully online, and our window opens October 1st. So it just opened this month, and it stays open until March 1st. And then we do our class selection by lottery. It used to be a state law that selection had to be done by lottery, and they just did away with that this year. So we may be changing how we select our classes. It's in discussions now. We're not sure exactly how that's going to go. Regardless of what we end up doing, it will take some time to switch things over. So for now, it's remaining the lottery basis. And I would highly recommend not waiting till last minute to submit your application. If there's any kind of question or you're missing something on your application and you've waited till March 1st to submit it, then you don't have time to correct it and your application is automatically kicked out. So applying earlier doesn't guarantee you a spot, but what it does is it gives you an opportunity to fix something or add something if we find we don't have something. I also strongly, strongly suggest meeting with an academic advisor on Foothills campus before submitting your application so they can verify you have everything that you need. Professional license that you earn upon graduation and passing the boards, again, are the national boards or the ARRT. That is the American Registry of Radiologic Technologists. They are our board exam. They issue the boards and give us our credentials. And then, of course, your state boards, like I said, which as long as you pass your ARRT exam, again, you just submit a check and you get your CRT or California state license. Here's the question everyone wants to know. How much money do you make when you graduate? So this varies. I will say that when it comes to boards and graduation and employment, that we have a 99% pass rate in our program. So in the 5 years I have been at Foothill, and your pass rate is determined by students who pass the national board exam on their first attempt. So 99% of our students have done that. There have only been two since I've been here that didn't pass the first time, and it was just barely didn't pass. They took it a second time and passed with flying colors. A lot of that sometimes is just nerves, test anxiety, figuring out how they're issuing the test and whatever, but they do great on their second attempt. You can take it up to 3 times. We've never had to have a student take it 3 times. Like I said, 99% of our students pass on the first attempt. Um, our salaries range, it depends on where you work. But they range from $60 to $68 per hour fresh out of school when you're barely starting. Um, for the amount of time and schooling that you put in, that is an excellent, excellent wage to earn. And they just go up from there. If you specialize, you make more money. For every year of experience, you make more money. You typically make more money if you're working in a hospital setting than a clinic, but everybody has their preference on what they like. If you aren't a blood and guts and trauma sort of person, you're probably going to want to work in a clinic, and there's nothing wrong with that. And you can work in urgent care. You can work in a dedicated imaging center where it's a clinic that's all they're doing are things like x-rays and CT and MRI and mammography. So that clinic is all just radiology or imaging. You could even go into commercial sales. You can go into management. Typically, management positions require a bachelor's degree. So while you don't have to have a bachelor's degree to be a radiologic technologist, you typically have to have a bachelor's degree if you want to go on and be in management. And then the last thing you can go into with your degree is to come back and teach our future students, which is what I'm doing now and I love. I still do work some weekend shifts. I fly back to Salt Lake City about every 5 or 6 weeks and do a weekend shift there just because I love patient care and I want to keep my skills up. So kind of get the best of both worlds where I get to be part of education and teaching our students, and I still get to have that patient interaction. Any questions?
Lisa, I don't see questions submitted by audience. But if you have any question for Lisa, please don't hesitate. Put it in the Q&A. While we wait for questions from the audience, I have a question for you, Lisa.
Okay.
Um, how is the job market like for radiologic technologists? Are there certain areas of the country in higher demand?
Especially in the Bay Area, they are in very high demand. There is a shortage of technologists. All our clinical affiliates are pushing for us to have bigger class sizes so we graduate more technologists that can go to possibly work for them. The problem is we still need faculty that can teach those classes, and we need clinical spots for them to go to. But the profession itself is in very high demand. Every single one of our graduates who wants to work, which is most of them, find a job immediately. We have an affiliate day, your last quarter of the program, where the managers from our clinical affiliates come in. It's kind of like similar to a job fair. So they come in and do little presentations about their clinical site or their clinical affiliate, what they offer, what they pay, what the benefits are, what positions they currently have open, at what times, and how many hours. So all of our affiliates present that. And then it's also an opportunity. They set up a tabling event afterwards for our students to meet with these managers, to maybe hand out their resume. But I will say that the program itself is kind of like a 2 year job interview. When you're going to clinic, those managers and those clinical instructors and those technologists remember those students who are outstanding and do a good job and who get along with others and provide good patient care. And it's not uncommon for when it comes towards graduation for a manager or a clinical instructor to ask me, hey, do you remember that student we had 2 years ago? They're graduating now, right? Do you know if they're, where they want to work, or, tell them we'd love to have them. So it's our students have no problem finding a job. We have that affiliate day that also helps, but it's also not unheard of that I think this year, as early as end of February, we had managers approaching our second year students who were about to graduate saying, hey, we have this position open. We'd love for you to apply. And that was in February. They weren't even graduating until June. So it's in high, high demand. And nobody's had a problem yet finding a job.
Sounds great. Wonderful. Okay, we have a question from the audience. Is the work physically demanding? Can an older person physically keep up with this job? Is it possible to get part-time shifts?
Absolutely. Part-time shifts or per diem work is absolutely available. It is physically demanding. It's very similar to nursing where you're on your feet all day long. I tell my students all the time, buy the cheap scrubs and invest in good shoes because you only get one pair of feet, right? So you're on your feet a lot. You're bending and stretching and extending and helping to move patients. And so it is physically demanding. But that being said, our student population has ranged from as young as 19 years old to as old as 53. We had a lady start who was 53 years old, and she did wonderfully. So it kind of just all depends. We have a lot of traditional college students, and then we have those non-traditional students who are maybe single moms, or they're first-time college students, first generation college students in their families. We have students who, we had a student who worked as a CPA for 20 some years and wanted a change in careers. And so we have several students who come back because they want something different, and do a career change. Because of the amount of education it takes, you have your 2 years in the program and about a year and a half of prerequisites. It's very doable, especially with the prerequisites. where you can do those part-time and where they work for you. Now, the program itself is full-time. There's no part-time aspect of the program. It is full-time.
So you mentioned that there are part-time shifts. After they graduate, they
Mhm.
can work part-time. How long are those shifts?
It just depends. Most shifts I would say are a minimum of 8 hours. Depending on the site, some places have 10-hour shifts. Where I work in Salt Lake City, we do 12-hour shifts. There's literally something for everybody. There's day shift, there's evening shift, or what we call second shift, that usually starts in the afternoon and goes until 9, 10 o'clock. And then you have their graveyard shifts that are the overnight shifts in hospitals. There's always technologists needed in the ER, in surgery, doing portable exams. So we have graveyard shifts too that technologists work. So it can be full time, it can be part time, it can be per diem, which is as needed, where you don't have a set schedule and you just pick up shifts. And it can literally be any time of day.
Thank you, Lisa. Question about challenges in the field. How do you handle difficult or uncooperative patients?
A lot of being a radiologic technologist is number one, being a listening ear and having that empathy. And number two, being a cheerleader, right? You're encouraging your patient, you're staying calm. A lot of times you're interacting with people who are having possibly the worst day of their life or the hardest time of their life with the diagnosis. So it's being understanding, it's being empathetic, it's remembering that they're going through something that you probably don't know all the details of. And just being empathetic, that listening ear, and being encouraging to them. um, I kind of have a reputation where I want to take the difficult patients. When a front desk person walks back a requisition and says, "Oh, this guy is really mad. He's not very nice." I take that as a challenge where I'm gonna make him like us, right? So I really kind of like dealing with kind of what people would classify as a difficult patient, because it's my job to make make the day turn around for them and make it a good experience.
Thank you, Lisa. Are there any continual education requirements for maintaining certification? And if so, how many hours do
That's a
people need to do?
great question. That's a great question. So, yes, there are continuing education requirements. You have to have 24 credits every 2 years. When you pass your board exam, that credential is good for 2 years. So, you renew that. You don't sit for your board every 2 years, but you renew that accreditation, that certification every 2 years. And when you submit it, I should correct myself. That's not true. You submit your continuing education every 2 years, but you renew that license every year. But every other year, you have to submit your continuing education credits that you've earned. And it has to be 24 credits or 24 hours in 2 years. There's a variety of ways to get different continuing education. You can attend conferences, which sometimes employers will pay for you to attend a conference. You can read different journals and take quizzes about it. You can do some online learning. There's a variety of different ways to earn those credits.
Thank you, Lisa. What advice would you give to students in the radiologic teleology program?
I think one of the best things they can do is learn time management. Um, like I said, this program is not like anything you've ever done. Even if you've been in school full time, being in a cohort program is very different. It's very demanding. It moves very quickly. And it's a lot of work. It's a lot of hard work. I have an associate's degree, a bachelor's degree, a master's degree, and my radiology program. Out of all the education I've done, by far my most difficult 2 years and most demanding was my radiology program. Um, Not my master's degree by any means. It was my radiology program. It's also where I learned the most. You have to keep in mind that when you go to college and you're getting a bachelor's degree, most of your classes are building on other skills you or knowledge that you already have or other classes you've already taken. When you come into radiology, you don't know anything about radiology. You don't know how x-rays are made or what they do or anything. So it's a lot of new information, and just you have to have the time to dedicate to your studies, and time management is a huge thing. That being said, we do have students who work part-time, their first year, maybe on the weekends. Um, Many students don't, but that second year, when you're in clinic 4 days a week and in the classroom another full day, most students are not working much. If they do, they're working part-time, maybe a weekend shift, but usually that's their time that they're studying as well. So it's just a lot of time management. And during our orientation quarter, one of the things we do with our students is we have them sit down and write out hour by hour how they're spending their time every day and how they plan to spend it in order to get everything done that they need to do. We have them schedule out eating and sleeping and bathing and studying and attending class and everything so they can kind of get on top of their time management skills.
Wonderful. Thank you, Lisa. I missed a question. There's a question in chat. Okay, question is, how much is diagnosis based on what the technologist sets versus the view of the clinician requesting the test?
Oh, well, so that's an excellent question. Let me educate you a little bit on this. So, as technologists, we do not interpret the images, right? You may see an obvious fracture and you know it's broken. You do not share that with the patient. That is beyond our scope of care, right? So even the physician who ordered the x-ray, they're not reading it either. Who reads and interprets the x-ray is a physician who has specialized in radiology. They've specialized in looking at and interpreting the images, and that's called a radiologist. And a radiologist is a physician that went on to specialize in reading the images and interpreting them, just like a physician can specialize in cardiology or pediatrics or dermatology. These physicians have specialized in radiology, and they're the ones that interpret the images.
Got it. Thank you so much, Lisa. Actually, that was the question I had for Lisa before we began this section. Thank you, Lisa. And I think that's the last question we have from the audience. So with that, I want to thank Lisa for sharing your experience and valuable insights with us today. We truly appreciate your time and expertise. And to everyone in the audience, thank you so much for attending and for your thoughtful, engaging questions. Your participation really added to the value of this section. We look forward to seeing you in our next event. As a reminder, I will be sending out a brief evaluation survey with a link to today's recording. Your feedback is incredibly important to us, so please take a moment to share your thoughts and help us improve future programming. Thank you once again, everyone. Thank you, Lisa, and wishing you all a wonderful rest of your day.
Thank
Bye
you so much
bye.
for having me.
Thank you. Bye bye.
Bye.